Healthcare for older people affects everyone, whether it's for yourself, someone you care about, or care for. It's an area where we're looking to make improvements. But first, let's set the scene. Cambridgeshire and Peterborough Clinical Commissioning Group, or CCG, is responsible for planning and buying much of the NHS healthcare services for people living here. We're led by doctors and other healthcare professionals who have a good understanding of patients' interests. In recent years, there has been a steady increase in the population of those over the age of 65. We want to make sure that we have the right services in the community so that people do not get admitted to hospital unnecessarily.
The changes to older people's care is being made because it is one of the top priorities of our new CCG, and we believe that services for older people can and should be improved. At a time when the NHS is facing many challenges, we have to make sure that we spend the money that's available to us as efficiently as possible. We think we can do this by ensuring that all the providers of health and care to older people work much more closely together than they currently do.
We've heard over the years from older people that the services they receive can be very fragmented, which means lots of different people coming into their home. And older people would prefer to have an individual or several individuals providing their care. So we're looking to respond to the concerns that older people have about how their care is delivered.
We want to improve older people's care and the care of people with long-term conditions. Our aim is for all types of healthcare, in hospital and in the community, to work better together around our patients' needs, and to better coordinate care with social services so we can keep older people as healthy as possible.
Well, from a personal perspective, I would like to see the discharge from hospital process improved, because I know from my own experience that many people are discharged from hospital to home and they haven't got the facilities at home, they haven't got the food or the heating or transport, and they've lost confidence. So I really think improved discharge procedure would be really good.
Perhaps the system has got to find time. People going into other people's homes, they're in and they're out. And that's not what a lot of old people want. There is no ailment, just loneliness, and would like to chat to someone for a little while. So I think this must be built into the attitude that we have towards dealing with older people.
We want to see services working more closely together, more integrated, and as a result of that, services and people working in a more integrated way to benefit patients. So we're hoping that patients will have a better quality of experience, whereby they will be able to move quickly between services, their information will be passed between services, and they will feel as though it's seamless and that they're not being left out at any stage in the process.
This is all about the quality of life. Lots of people, when they get older, have things that we can't actually cure anymore. But it's very important that we keep an eye on them, that they, with these illnesses that they might have or conditions, that they have a good quality of life and can live out their life in the way they want to do, where they want to do it, rather than being shunted from here to there to everywhere to try and achieve that.
We've set up a team of healthcare professionals and managers to look at how we can make sure our older patients see improved services.
I'd like to see older people of my age having the chance to have an annual health check, really to help not only on where I am at the moment or where they are at the moment, but also some ideas of how you can maintain your health.
The Older People's Programme will benefit the region by making it much easier for patients to be able to access services for older people. And we all know that older people have a lot more difficulty frequently. And one of the feedback points we've had from patients and from carers and families is how difficult it can be to actually know what services to get and from where. So the idea is to develop an integrated service where both physical and mental health services are involved, so that patients don't have duplication, they know where to go, and a single point of access so that patients can just access services from one point.
I'm sure the Older People's Programme will benefit this region because we've got a large and varied population with different needs in different parts. This means that we need different services in different areas, and I'm sure this process will improve the outcomes for all our patients and also improve the experience that they receive from the health service.
In the future, we are looking at care that is better organised, with services working together to deliver a patient's care and easier access to healthcare services. For more information about our Older People's programme and to see the latest updates, please visit our website.